Hey, Dr. Shakib here from Irvine Spine and Wellness Center, your Irvine Wellness Clinic. Let's talk about pelvic floor. So many people don't have a clue what that is, and they don't understand all the package that goes with a pelvic floor dysfunction. So stay tuned. All right, so in this video, we're going to be talking about pelvic floor exercises, pelvic floor dysfunction, what that even looks like, and if pelvic floor dysfunction is for men, what kind of exercises they need to do. A lot of people associate pelvic floor with women issues. Is there any workout for pelvic floor? What exactly needs to be happening? Some people do stretching that think is going to contribute positively to pelvic floor. Some people do biofeedbacks. It's all about the pelvic floor. So in order to understand what pelvic floor is, I want you to imagine a paper bag. So this is the sides of the paper bag, and the bottom of the paper bag is your pelvic floor. Right above that is what pelvic diaphragm is. And we've done plenty of videos on that. I'm going to make sure that we include it right after this video so you can understand it if you don't know already. So if I have a paper bag and the bottom is loose, it doesn't matter how wonderful the contents in the bag are. If the floor doesn't have the strong integrity, it's gonna fall apart. So a lot of times with the therapies that are being done, a lot of times you go to a therapist and they actually go through the anus or vagina and they get into the inside of the bag, the pelvis, and they work on those muscles there. The issue there is similar to having a bad back, and then you go to a massage therapist and they work on your back. It feels good, it does some work, but it really does not last. So the real solution to that is doing something, whatever it takes, to strengthen those muscles. So we're going to come back to that in a moment. But if we go in and the bottom of the bag is falling apart and you just put another piece of paper on top of the fallen apart bag without building the sides to that bottom that you just worked to create, it's still gonna fall apart because it's not gonna last. It doesn't have the support of the surrounding structures. So in my practice, pelvic floor dysfunction does not show up as incontinence, either urinary incontinence or fecal incontinence. Pelvic floor is that very bottom part of you where the vagina or penis and the anus is, all that on the outside, and then the surrounding inner lining of your pelvis. That's what, at the very bottom, that's what pelvic floor is. So you can have urinary incontinence, you can have fecal incontinence. Pelvic dysfunction doesn't just show up in those two presentations. You can have an SI joint dysfunction, it's in the pelvis. You can have pelvic pain, you can have lower back, you can have hip issues, you can have lower extremity issues. In fact, every single dysfunction that has to do with movement impacts the whole breathing mechanism, from the pelvic diaphragm to the vocal diaphragm, and right below that, if you don't have the integrity of that barrel that we've referred to in previous videos, if you don't have that strong inner lining, it's only a matter of time before the pelvic floor dysfunction happens and manifests itself in different forms. So you gotta be careful. There are a lot of things that are taking place, and there are a lot of us that are having issues, not because everyone gives birth or has difficult pregnancy and has issues with childbirth. In fact, I'm seeing more and more pelvic dysfunction in men with manifestations like incontinence in men. That's because we're sitting down a lot. We don't work out the muscles. Every muscle has to move functionally and work effectively. When the lack of effectiveness comes to the picture, the dysfunction happens. So if we can do exercises, right now, if you want to do exercises on your own, you refer to a Kegel exercise. Kegel exercise is when, well, just look it up. I'm not going to do this video on Kegel. But there are machines out there that actually do that's close to 7 Kegel exercises a second. Let's try that. Look up Kegel exercise, see how many you can do in 1 second. So that has a lot more chances of being effective, but not by itself. While you're building that muscle or those muscles, that pelvic floor, you gotta work on the surrounding areas. And no, I'm not referring to strengthening your core by doing the abdominal crunches. If you've been following me on YouTube, you know exactly what I'm referring to. So watch the videos that I'm gonna put after this video. Make sure you understand what's going on. If you have any questions, call the office. You can talk to my team here. They'll be more than happy to answer any questions. If it's too specific and you want to talk to me, just let them know. Make sure you follow my YouTube videos and my channel, because it's not about what I know, it's all about what you know. Thanks for watching. Take care.